So, I mean, it feels loose, feels good. You kind of tell me, like with that pressure, what's it feeling like?
I feel like a little bit up here.
Okay.
Let's see, what day was it? Sunday when I was doing my exercises, I was doing some squats and I tried going a little deeper.
Yeah.
And then all day yesterday I could feel it.
Okay.
So I must have gone a little deeper.
Yeah. Hey Jeff, when you get a sec, will you grab that orange ball that's behind you on the back wall? Bring it over. So are we in week 4 using the brace?
I got it on the 9th. I marked it down on the
The
calendar.
9th?
So.
Thank you.
Okay,
And then
tell you
hang
what
out
today
with
is.
us. I want to pick this leg up for me. I'm going to put it right on there. And then just let it rest for a second. What's today? What's today's date?
27.
So 3 weeks? Seems like you've been using it longer, but I mean, that's awesome. You got it on the 9th. 2 full weeks, 2.5 weeks. Wow. My days are all blending together. Okay, so I think you remember, so she had the total knee replacement in February, had the manipulation in June. We started working together when?
I don't know.
I know it was after the manipulation.
Yeah.
I wanted to say it was in July. You didn't come immediately after.
No.
I mean, it seems like it was almost a month or so since
Yeah,
the
because they
manip.
sent me to Athletico first, and then I flat out refused to go back to them.
Okay. Get me a goniometer if you would, please.
I don't know, maybe August?
Okay.
Really don't know.
That's all right. I've got it in the chart, but I don't
Like you
have
said,
the chart
everything
handy.
just blends together.
It does. All right. So let's see.
We thought things would sort of straighten out when Dylan started going back to school.
Uh-huh.
Monday, Tuesday, he's home, has homework. Wednesday, he does online school, and Thursday, Friday, he goes to school.
Oh, yeah.
And then they got a message yesterday that one of the teachers had COVID.
Oh, what?
They
Oh,
were not
no. So, like I can't see it from your angle, but about 107. And I mean, we're not pushing hard yet. Seems pretty comfortable. Can you kind of scoot your bottom forward? There you go. Just so we have a little bit of room. So some of my benchmarks, my initial benchmarks, what I'm looking for usually, when the leg is down, you know, as I kind of bring it back here, this is one of my benchmarks. Now she slid forward, so it's a little bit tighter. I'm not going to get to that right here. But I always like to have some point of reference, even without measurement. You see the difference between you and I measuring. Even just myself, like I can measure 3 times in a session and get 3 completely different numbers.
Yeah.
A 5-degree margin of error is totally reasonable. But the problem is the client, 5 degrees to her is a huge discrepancy, you know? So people will get what they think are great numbers one day and then what they think are terrible numbers the next day, and it's dejecting. And but there's got to be a better option. We always go back to function. You know, can she squat? Can she crawl? Can she get on the ground? Do those things. That's what's important. She didn't get a knee replacement so she could get a goniometry measurement of 120.
Right.
She did so she can go hiking and do the stuff she wants to do, and she's doing that. So, a little bit of pull down, a little bit of kind of oscillation with it, And then when I'm working back into flexion, I'm back up here. So like the thenar eminence is on either side of the tibial tubercle. I'm pressing back and shaking a little. And then with this, the same thing. This allows me to get a little lift. It allows me to get a little bit of leverage. Now, you tell me, correct me if I'm wrong. I mean, I certainly would say we did reach new numbers using the device.
Mhm.
We're only at 2.5 weeks, so that's pretty good. I was thinking we were at 4 weeks. The question is always, so is the brace what makes the difference, or the fact that she's intentionally putting the time in to increasing flexion is what makes the difference? I don't know. Nobody knows. Either way, it's working. And so we're going to go back to focus on flexion with the brace because we switched to focusing on extension just a little bit. Now, is most of your discomfort on the inside still when we're getting back here to this end range
It sort of goes like across.
across the top? Reposition this.
Oh, I had a question.
Yeah.
You know, I cough with the allergies.
Okay.
Been having trouble finding my allergy medicine because apparently everybody else's allergies are flaring up too. If I'm having a day where I'm coughing a lot, should I just not come?
Yeah, that's fine.
Because yesterday it was awful. Today I still kind of sound funny, but
Sure.
haven't been coughing yet.
Yeah, it's not a big deal to miss a day. And
Well, I just don't want to freak anybody
I know,
out, especially
that's-
if maybe there would be a new person here.
sure, absolutely.
I mean, if I had a fever or something, I wouldn't come in
Right.
today. But
Right.
I think it's kind of funny if you're.
We'll start with this one. This is a piece of cake for you. I want knees a little wide, the same way you do the butterflies over there on the step. We'll kind of get the butterfly position here. I go up in one motion, down in one motion. The kettlebell hits the ground the same time my feet hits the surface here. So let me see a couple of those. Right
Is that
there.
your limit when you're doing that? When you get that far?
No, I don't want to do it. I'm like a little kid. You're telling me. I've heard some dogs say that too, but I just can't. Because they know that's my favorite. My son,
Let's just put it right here. Slide your hips all the way back. Perfect. Let me grab.
Can you hold the thing when I tried to move my foot back?
Yeah.
It came with me.
Yeah. So what do you feel at that point?
It feels tight.
And is it still the tightness in that area?
It's like there. It's been tight down through here the last few days.
You got two more in you?
Yeah.
Relax.
Yeah, you gotta take advantage. Today's supposed to be the last nice day.
Good.
It'll probably be pretty muddy, but do the trails you go on stay muddy for a while?
Should I switch?
The place we're
Yes.
going to today was a golf course, so it has
Oh,
the
okay.
paved and it has the regular trails. So
Yeah.
we usually decide when we get there what we want to do.
Yeah.
The last time we did the regular trails,
Uh-huh.
where it joins up Elk Creek Park to Seabog, and it's horse trails and all this, and there's a lot of steep areas. But it's more like your regular hiking trails,
Right.
where the other ones are, they're flat, they're easy to walk on. There might be a slope here and there, but there's nothing steep. ones we went on the other day had a lot of steep stuff,
Yeah.
but it was nice.
Yeah.
We saw some kind of huge bird. We didn't see it good enough to figure out what it was. But that thing had a wing spread.
Uh-huh.
Whenever,
Okay.
I'll wait on you.
I've got you on. I'm good. What did he say, before or after?
Oh, I didn't ask you.
Okay.
You said you'd rather do it before.
Before is better for me.
Okay.
So that's 108 again.
Yeah.
Right there.
Yeah. You want to flip? Yep.
Let's see if we can kind of lift up
You all right? You
everything.
want to take a break? Take a break.
No,
Right there. It's gonna straighten you out.
pain right in there.
And just do your best to kind of settle in. Let that hip come down.
Well, like when I
Don't
lift
let
it
it
up,
just
like right now, when
spend
I
a little time
lift it
there.
up,
This part
Oh
right
my.
here.
yeah,
What you got?
It's got Tuesday at 1:30 and
Yeah.
Thursday at 11:30.
Okay. So Tuesday.